Yeah.
Dr. Stapleton, when were you diagnosed with type 1 diabetes? You see, I don't remember life pre-diabetes because I was so young when I was diagnosed 44 years ago. So, but you were diagnosed when you were an adult, right?
Yeah, so I'm 51 now. I was 41, so it's a little bit over 10 years ago now. And yeah, I mean, it's interesting really when when I look back. So I had with a group of my university friends, we had started doing. You can do the Noosa triathlon. It's quite a big triathlon in Australia, and you can do it as a team where you each just do one leg of the triathlon. Essentially, it's like a relay, I guess. And so I was doing the cycling leg in the team, and a friend of mine who's an orthopaedic surgeon, he does the swim, and then another friend of mine who's a cardiothoracic surgeon. We all went to uni together. He would do the run. And so I had been training for that, and then, I was weighing, I've never been overweight, but I was carrying a couple of extra kilos, and I was sort of thinking, it'd be nice to drop them down. I used to weigh, I guess, around 80 kilos. And anyway, in the lead up to this training, I started dropping, a kilo a week. And I thought, this is good. It's partly the training. I had actually, interestingly, I had read a couple of books on sort of diet, and I had come to the conclusion that sugar was something that we should be limited in the diet. So I was sort of already on that sort of pathway, I guess. And so I had taken sugar out of my diet. And so I was dropping a kilo a week, and I thought, this is good. This must be that I've dropped the sugar out of my diet and all that sort of stuff. And then I, started waking up at night and having to wee every night, to pass urine every night. I thought, it's, a bit odd, but didn't think too much of it. And then, this sort of weight loss really, started to accelerate. I was sort of getting tired and, again, was having to wake up every night to go to the toilet. And then I woke up one morning and I sort of looked at myself in the mirror, and I could see that I really started to get lean. I dropped down to about 68 kilos in the end. And then I thought, oh wow, this is like not right. And I had some people comment too, oh gee Troy, you're looking a bit lean type thing. Anyway, I thought to myself, it couldn't be diabetes, could it? Just as a sort of couldn't be that. Anyway, interestingly, a few years prior, one of my boys, I've got 3 boys, one of my boys had been sort of toilet trained, but then he started wetting his pants, and I'd sort of worried that it could have been diabetes, and so I dipped his urine. So we had urine dipsticks in the cupboard, so I thought, I'll go and dip my urine, thinking it would be like dip my urine, no glucose in the urine, it's probably okay, and just sort of get on with, lost a bit of weight, that's all right type thing. Anyway, it came up 4+ of glucose, I think 4+ of ketones as well. So, I was like, pretty sure I had diabetes at that stage. And then I went to work hoping that, maybe the dipsticks are, not accurate, or, something like that, and then tested my blood glucose at work, because obviously I didn't have a blood glucose meter at that stage. And it was, it just read high. And so then I went to, fortunately I knew one of the endocrinologists at work, and I went and saw them, and they did a HbA1c on me. They did antibodies, and they measured my blood glucose, and they could get a number, and it was 32, and my A1C, I think my A1C, it was about 11.4 at the time, and my antibodies were through the roof, actually. They were in like the thousands. So yeah, I had a confirmed diagnosis of type 1 diabetes.
So you were in medical school then, right? Did you know much about type 1 diabetes?
I was a radiologist then, 10 years ago, yeah. No.
So did you know much about type 1 diabetes?
Not a great deal, to be honest. Like I had done pediatrics as one of my terms. Like as a junior doctor, I had done what we call a principal house officer job as in pediatrics. So I had diagnosed a young 2-year-old boy with diabetes. So I knew a little bit about it, and I had done also some rotations as a medical registrar. So I had managed people with type 1 diabetes. But, I really didn't know a great deal about it, to be honest. Like, I knew some about it, but not as much as obviously I know now. And I guess as a radiologist, my interactions with it would be, sometimes we'd be diagnosing the complications of diabetes would be mine.
Mm-hmm.